Welcome back to Sage Connections. Today, we're diving into a fascinating and often overlooked topic: how oral health connects to our overall wellness. I'm joined by Dr. Fadi Assaf to explore the ways jaw health and everyday habits influence the rest of the body. We'll talk about the connection between the jaw and posture, what to look out for during pregnancy and postpartum, the role of tongue posture and airway health, and some of the most common dental myths he wishes more people understood. Whether you're a patient, a parent, or just curious about how the mouth affects the body, this conversation is full of practical insights you won't want to miss. Enjoy. Tell us a little bit about, well, first of all, where you're located and what communities you serve and how you got into dentistry.
I have two offices. I work in Farmington Hills and I have a satellite office in Shelby. How I got into dentistry by coincidence, honestly. I have a friend who advised me to pursue dentistry because it was his dream. I wanted to do engineering. So when I was in Michigan State, I asked my local dentist, a good friend of the family, to shadow him. And I fell in love with the profession and I went, met with advisor, and I pursued it.
Fantastic.
Yeah.
So, what are some of the most overlooked aspects of oral health, and how does that impact the rest of the body? So, just beyond cleaning and cavities, I think most people do that, but is there anything else to add to that?
Well, most people, if you take care of your teeth, most people are not going to have major problems. Most people are going to have a one or two cavities or maybe a little grinding, assuming you don't have any trauma or accident in your lifespan. Some of the misconception is, well, I don't need to go to the dentist. I brush my teeth. Or I don't have to visit the dentist every 6 months. Even though if you're taking care of your teeth, you're not going to be able to reach some of the area that the dentist can. You're not going to be able to take x-rays. You're not going to be able to do an exam and diagnose oral cancer, God forbid. You're not going to find out if you have any abscess or any trauma from grinding. A lot of things that people overlook, and it could make a significant effect in your life.
Yeah. So I treat a lot of patients who are pregnant or just postpartum, a lot of women. What are some changes that you see in the mouth during pregnancy and postpartum that you might not see in other parts of life or or in men, I guess?
Well, when the a woman is pregnant, let's talk about treatment. There is no need to do any dental treatment in the first trimester. It's a little bit dangerous because the baby's forming, unless it's absolutely necessary, where there's a severe infection and intervention is necessary. Second trimester is the safest one where you could do cleaning, but really you don't want to do major work. You don't want to do cosmetic, you don't want to do implant. Third trimester is also prohibit to do dental treatment because delivery could happen. So second trimester is the safest. Now, what is it that we see? A lot of women experience pregnancy diabetes during pregnancy because of the hormonal changes, and that causes inflammation um, with the gum, and then cleaning and prophylaxis is recommended.
Interesting. Okay. What about, so you mentioned the gums and inflammation. What about jaw tension, a TMJ? What can a woman do in pregnancy if she can't come? Well, I guess if she comes to see a dentist in the second trimester, then technically that could be kind of like the 6 month mark, like she would normally.
Yes.
Um, but is there anything else she can do extra during that time to help with inflammation or help keep her teeth healthy?
Floss, brush, I would avoid carbohydrate, meaning extra pasta, extra bread. Nutrition is very, very important, not only for the pregnancy, it's only to preserve the teeth. Flossing is extremely simple and extremely useful. You're going to have extra bleeding, and that's sometimes a sign people get scared. But in the beginning, you're going to have bleeding. But as you floss, the bleeding is going to decrease.
Okay.
But
So,
that's the best thing you could do for yourself.
okay. So I think this is a common question. Do you floss first and then brush, or brush first and then floss?
Very good question. I tend to floss first, then brush. Because when I'm flossing, I'm getting all the bacteria deep between the teeth. Then the toothbrush comes in and remove everything.
Okay.
And then go ahead, sorry.
What about the tongue?
Brushing the tongue is very good because sometimes we can't, there's bacteria on the backside of the tongue. Brushing the tongue also remove all that bacteria. Now, using Listerine or Scope, sometimes it's not the best thing to do because there's alcohol and that so dry the mouth. Some people who have halitosis or bad odor or bad breath could mask it with Scope or Listerine. The problem is once that dries out and alcohol take effect, it comes back very fast.
Okay. What about some of the non-alcoholic or
More beneficial,
okay.
more
Okay.
beneficial. There are
Every
some
day?
if you need it, yeah. If you have halitosis, but there's a series of steps you should pursue in conjunction with oral medicine. For example, if you haven't had a cleaning for a while and you have a heavy layer of calculus, you should remove it. If you're eating offensive food, for example, red meat, garlic, onion, alcohol, smoking especially, this is always going to contribute to bad breath. So you have to cut all of this, all of these element. Then you, if it doesn't help, and a lot of time halitosis or bad breath comes from our gut, not only from the bacteria of the mouth. So that's coming from the food we're eating.
So I also heard that acid reflux could also potentially lead to bad breath. Is that true?
Correct? Correct. So if you have an acid reflux, you have to see your GI tract physician. And then probably they'll prescribe maybe Prilosec or Zantac or it has to be treated because all that acid is coming back to your mouth.
Yeah, right. Okay, so how does breathing, especially mouth breathing versus nasal breathing, impact your jaw development, sleep, and long-term oral health?
Most people breathe through the nose, which is great. If you don't and you breathe through the mouth, what are going to happen is you're going to have a dry mouth because all the air that you're sucking in is going through the mouth. And this is going to cause a dry mouth. What's going to happen is teeth like saliva to wash out all the bacteria. You're going to have high incident of decay because you're breathing through the mouth. The tongue gesture is going to be a little bit more challenging. So you might have sleep apnea
Mm.
and you're not going to be able to sleep well. How do you train yourself? It is hard. There are some specialists in that field that could help you breathe properly, but it's not an easy thing to do, like grinding. If you grind, which is squeezing your teeth together, or clenching, which is actually clenching is squeezing your teeth together, grinding is moving your teeth against each other, like rubbing your teeth. It's very hard to stop. It's not a habit you could control. So you could do it either during the day or at nighttime. The only thing that stop it or forces you to stop it is Botox.
Oh, interesting.
Yeah.
So is there any spe I don't know if you know of any reasons why some people grind and clench more?
Stress, stress,
Stress.
stress is the main reason. You could never grind, and all of a sudden you're going through a traumatic experience. You lost a job, you lost a loved one, you're struggling in your life, and you start clenching. You're squeezing your teeth as you're watching TV, or at night you grind. And believe it or not, all it takes is 30 seconds of grinding, and you could see the effect on your teeth. And a lot of people do grind. And nothing, and grinding is triggered by the muscles. The muscle is the weapon that moves the jaw. And the only way you could relax the muscle is by injecting Botox.
Okay. This is
And
true for children too?
I don't know about children, to be honest with you, because I
Okay.
don't see a lot of children.
Yeah.
My main focus is adult.
Okay.
Children is going to be a little bit more tricky.
Hmm.
But for adult, Botox, but the problem is it's a little costly and you have to do it on a regular basis until the habit disappears. Now, with Botox, a lot of people have concern that is it gonna change the shape of my jaw? It doesn't. It just relaxes the muscle.
Okay. So what's interesting with what I do as a pelvic floor physical therapist is there is a correlation between TMJ and clenching and grinding and pelvic floor tightness. So I usually see them in conjunction with each other. And so,
Really? And
yeah,
in what way?
so when people are under stress and they do that grinding, they're also breathing with their accessory muscles. And so
Okay.
when they do that and they don't breathe with through their diaphragm, their pelvic floor is upregulated. So they
Okay.
also have pelvic floor pain or tightness and symptoms resulting from that in conjunction with TMJ. So I usually treat both. Uh, it's very rare that I have a patient that has one and not the other.
It makes sense. It's tension.
Hmm.
The
Yeah.
muscles are triggered, and the whole body, the shoulder, the mouth, the pelvic floor, everything is tense.
Right. And you're in that sympathetic response. And so
Yes.
until you learn to get into the parasympathetic system, which we work on a lot through breathing techniques and other ways to relax the body, the pelvic floor specifically. Yeah, until you get into that parasympathetic response, it's very difficult to have changes in those symptoms.
To make someone relax.
Hmm.
I mean, in the oral cavity, we could provide a bite guard or bite splint, but unfortunately, it doesn't stop you from grinding. It just protects the surface.
Mm,
Only thing is muscle relaxant, and the best one in the injection is Botox.
awesome.
Yeah.
Interesting. Okay. So what role does tongue posture play in overall oral health and airway health?
Tongue posture is if you have a tied up tongue or a big tongue, it's gonna be a little bit difficult to breathe. If it's difficult to breathe, you're not gonna sleep well. From my experience, this is my limited experience with the size of the tongue. The good news, we don't see too many people with tongue problem. I had a couple of patients actually. One of them chose to do a tongue surgery where they had to reduce the size of his tongue. It's very painful and it takes a long time to heal. But he did better and it took him about a year to heal.
Wow.
Yeah.
Okay. So how early in life can oral habits shape the development of the jaw and the airway? Like, what can parents, um, or what should parents be looking for? What habits can they instill in their kids to have healthy oral
Early
health?
early brushing. 2, 3 years old.
Hmm.
Frequent visit to the dentist, 3, 4 years old, just to eliminate the fear. I don't see kids on a regular basis. But when I have some of the dentists who work with me, we use very friendly term to the kids, Mr. Suction. This is, we have a lot of toys just to make them break the fear.
Hmm.
And then just have them use the toothbrush on a regular basis. Now, things to watch out for. Definitely no pop, no Pepsi, no Diet Coke, no Sprite, because that will cause high incident of cavity. Don't let the child take a bottle to bed. It will cause cavity. Avoid candy. I know the grandma wants to give them candy. If you want to do it once and be done a day. Don't keep doing it throughout the day. Um, Also, as the child gets a little bit older, of course, if you're gonna see the dentist is gonna see it and he's gonna recommend to see an orthodontist. if there's a discrepancy in the jaw. Could be that the upper jaw is too forward or the lower jaw is too forward. And when they're younger, it's easier to correct these discrepancy, and your orthodontics is the best person to do it. They might select surgery, they might select to use some appliances. So the main things are good oral hygiene, establish a relationship with your dentist, eliminate the fear, and monitor the growth of the jaw.
Okay. Do you have any thoughts on thumb sucking?
Yes, I mean some kids do it. There are some appliances to start to make them stop. They just do it for emotional comfort.
Yeah.
And then you notice when the child, we know it right away because they would have an anterior and open bite. So when they close, their front teeth don't touch.
Mm.
And we know right away that they're sucking their thumb. Usually, I refer them to a periodontist or an orthodontist, and there are some appliances they could use to help the child stop that habit.
So it's better to, if you can wean them off that habit as soon as possible, that's,
100%.
yeah. Okay.
Always good to eliminate this habit when the child is young.
Okay. So from, sort of the early stages of life to the later stages of life, I know you work a lot on people that lose their teeth. So can we talk about that? How does, why does that happen to some people? How to prevent that? What that does to the jaw, to quality of life, and then what to do about it?
Absolutely. As we age, we lose teeth, whether it's we did everything the tooth started with a cavity, went to a root canal, went to a crown, then it broke. So we lose teeth through life, not taking care of our teeth due to, let's say, gum disease or cavities, trauma, accident. And when we start losing multiple teeth, it's devastating. Number one, our facial structure change. We lose confidence. We don't eat well. We don't function well. It's like we're walking on only one leg. And it's technology today is so amazing that we could replace all your teeth. We could give you dental implant. Within few months, you could restore your whole smile, bring back your confidence. You don't have to wear a denture. You don't have to worry about going to bed next to your significant other, leaving it and putting it back, and you lose your confidence and self-esteem. And you eat better, you chew the food better, and then you feel good about yourself. It is a surgical procedure. It takes some time. It is a little uncomfortable, but it will improve dramatically your lifestyle.
So this is something that you don't have to take out every night?
Yes, you don't have to take out. And I always give an example to my patient and I say, imagine, God forbid, imagine you lose your sight. You lose your ability to smell. You lose your ability to hear. I'm not giving you a hearing aid. I'm not giving you glasses. I'm giving you a whole complete vision. You could see, you could hear all of this sudden. Now, not to the same ability as you were when you had your teeth, because we're not as good as the creator, whoever you believe is the creator, but we're pretty close. You have nice white teeth, you could chew, you could eat, and you look good.
Yeah. Fantastic. I'm wondering like how many people know that, you know?
More and more people are getting educated because of the social media and the internet. I have a lot of people coming to my office and asking about the procedure, whether it's one tooth, two teeth, or full arch. Um, Technology is so easy right now where we could even give you temporary teeth within a day or two. A lot of dentists all over the world are applying this method.
Okay. Are there any common dental myths that you hear from patients?
The majority of it is, well, I brush my teeth, I don't have to go to the dentist.
Hmm.
Sometimes people say root canal are bad for you, for your health. There was one time a movie on Netflix that came up about, and it was a bad reputation. I truly disagree with it because a lot of time the tooth has trauma in it, whether because of a cavity or an accident, and the only solution is root canal. Myself, I had to, I didn't have any problem. Some of my family member had it. It's a great treatment to save the tooth and prolong its life. Sometime after maybe 10 years, you lose the tooth, but you got 10, 15 years out of it. So one of the big myths is root canal are bad for you, or the fact that I don't need a cleaning because I brush your teeth. You're gonna be able to clean certain area of your tooth, but you're not gonna be able to go deep like your dentist. And as I stated in the beginning, the dentist is gonna see so many things, and he's trained to see so many things that you can't.
Hmm. Yeah. What about, have you heard of burning tongue during menopause?
I did hear about it. I see it once a while. It's a condition. It's a chronic condition. It's triggered by hormone, sometimes stress. Sometimes we really don't know what it is. It's just the tongue becomes, it gives you a little burning sensation, a numbing sensation when you eat certain food, uh, or sometimes just without any trigger. There is no actual treatment to it except monitor stress, acid reflux medication, monitor your diet. Don't eat a lot of spicy food. Um, Sometimes women get it before during pregnancy and it disappears, like a pulse palsy, where one of the side of the faces
Hmm.
um,
Yeah,
gets numb.
Bell's palsy.
Pulse palsy. I'm
Yeah.
sorry, it gets numb, and then after a few months, it comes back.
Okay. So it's almost like a nerve, uh,
Yes.
yeah, one of the nerves that supply was that trigeminal. I can't remember.
I think it's
Facial?
facial
Facial.
nerve. Yeah,
Yeah. Okay. It's been a while since I've done the nerves in the face.
it's okay.
Um, so in terms of us working together as a physical therapist and a dentist, can you talk about just for people who are dentists or people in professions, in the medical professions, how do you think, we can work together?
You would be a great integral part for TMJ, maybe muscle therapy, where someone cannot control their grinding, or they have headache, or they have tension. I know you helped me in the past with my shoulder, and therapy, it takes time, but it does work within time. A lot of time when I cannot offer any solution. I sell to TMJ specialists, and the some of the therapy they have is the occlusal guard, but that's it, or Botox. Sometimes working with the facial muscle does help, but it does take time.
Yeah. Well, and also let's talk about just dentists in general, the posture that you guys, or surgeons,
It is
that,
tough on us. It is tough on all dentists, yes.
yeah,
Because once we get into the room, we focus mainly on the patient. We don't really focus on our posture. You lose yourself, and after you're done, you say to yourself, "Oh my man, I'm very sore." And if you don't do therapy on a regular basis, you don't stretch, your work expectancy, the life of of you working is short, or it's really miserable.
yeah. I mean, I think that's true even, for physical therapists, anyone who works a physical job, right?
True,
Whether it's
true.
construction or being a dentist or physical
Hairdresser,
therapist.
yeah,
Yeah, massage therapist. Like
yeah,
everybody needs upkeep,
yep.
yeah, to stay, healthy for longer.
Maintenance,
Hmm.
yeah.
So, last question, what trends or innovations in dentistry are you most excited about that people might not know about yet?
Um, uh, Clear braces, like invisible braces for people who are adult, they're older, they don't want that metal braces in their mouth. The clear one is an amazing invention that it's came along, and it changes the teeth within few months. Dental implant, and then the fact that we could give you teeth within 24 to 48 hours to establish your smile and self-confidence. Also, it's an amazing addition. They are working. I don't know. I keep hearing about it, about stem cell therapy where they could rejuvenate and replace the teeth. Is this coming? I don't know that you could replace your teeth right away. Also, the innovation of how fast we could do the crown with the milling machines and how advanced they are. It used to be 2 weeks until you get crown. A lot of offices now they have their own machine where you could prep the tooth and you get the crown the same day or the next day, which is a great thing.
Hmm. Wow, all good news.
Yeah,
Yeah. Well, thank you so much.
it's my pleasure.
Yeah, this was very informative. And do you have any final words, anything to leave our audience with?
Yes, I would say definitely for people who are experiencing sore muscle is great to find a therapist or someone, okay, someone who is comfortable working with you for to do the therapy on a regular basis. From my own experience, it takes time, but it's a really, really good way to alleviate the pain and feel better because you can't live on medicine. And surgery sometimes is the answer, but it's the last resort.
Yeah, great. Okay, thank you so much.
Thank you for hosting me.
Thank you so much to Dr. Fadi Assaf for joining me and sharing his wisdom and perspective on the connection between oral health and overall wellness. I hope today's conversation inspires everyone listening to think more holistically about their health, pay attention to the small daily habits that make a difference, and feel empowered to take proactive steps towards their well being. As always, thank you for tuning in to Sage Connections. If you enjoyed today's episode, please subscribe, share it with a friend, and leave a review. It helps us grow this community and reach more people with these important conversations. As always, take care of your health and your wellness.